Hello, and welcome to patients of Hôtel-Dieu and Fleurimont hospitals who will soon be undergoing an orthopedic hip replacement surgery. This segment provides information about the different types of hip surgery and the movement restrictions that follow. When you were scheduled for hip surgery, you were informed that you would have either a total hip replacement or a femoral head resurfacing. We'll introduce you to both types of surgeries. Total hip replacement involves replacing the two parts of the joint that make up the hip. The surgeon will insert a rod into the thigh bone, called the femur, and a cup into the cavity of your pelvis. These are the two components that are inserted, the dark blue half moon and the light blue stem. Hip resurfacing involves replacing only the worn surfaces of the thigh bone. Here, the red area represents that a larger portion of the thigh bone is preserved. The next slide shows the extent of both surgeries. Both types of surgery are shown on the screen. Hip resurfacing surgery is shown on the left, and total hip replacement is on the right. In order to reach your bone and perform the surgery, the orthopedist must move aside certain structures like muscles and ligaments. These structures are therefore more fragile after surgery, but they are what keeps your hip in place. As you've seen in the previous slides, the hip consists of a ball that fits into a rounded cavity. After surgery, there's a risk that the ball might come out of the cup component, which is called hip dislocation. To prevent this from happening and to foster the healing of the muscles that stabilize the hip, you need to avoid some movements. Please refrain from engaging in any of the contraindicated movements for 3 months after surgery. Around the 6th week, you will have a follow-up appointment with your orthopedist, who will tell you whether or not, if you can ease up on the restrictions. You have 3 movements to avoid. First, don't hold your legs together. Second, don't cross your legs. Third, don't bend your hips more than 90 degrees, which is the angle formed by your chest and thighs. The top image on the screen shows the 90-degree angle to be aware of. You should avoid bending beyond this angle. To be clear, your hands should never go below your knees. The next segment provides tips on how to prepare for your return home, so we invite you to watch it now.